Now, as many of you will know, there's been another case of Ebola linked to the first case. And what I'm going to do is I'm going to run through this press conference, not all of it because it's 15 minutes long, but some selected bits of it, because here we have some more proof, really, that the CDC's measures are really ineffective and that they're probably lying about just how bad Ebola is.
Any potential Ebola cases as early as possible and getting those individuals into treatment immediately. Finally, we have put the emergency department at Presbyterian on diversion until further notice because of limitations in staffed capacity. That means ambulances are not currently bringing patients to our emergency department.
Okay. Well, later on in this video he talks about there being 18 staff who are under observation for Ebola. Yet, are they telling me that this Presbyterian hospital, which is actually quite a large hospital, only has 18 emergency staff? Yet they have closed the entire department where the actual Ebola patients have been taken to. I think there's more to it than this. I think what it is they're starting to realise that the measures recommended by the CDC are in fact ineffective.
While we are on emergency department diversion, however, we continue to fully care for all of our patients to Mr. Duncan's care, even if they are not assumed to be at significant risk of infection.
In consultation with the CDC will
And
be working with
here we have
to
the judge
all of the
who went round to
monitor pool. We're monitoring 48
excuse me, just a touch of
in the
Ebola.
monitor pool, and so the people.
Whoa. Ebola's so bad I can't even talk about it without coughing. Excuse me, that's better. Well, this is the judge who went round to the home of Mr. Duncan without any protective equipment on. And you will notice that he's not looking too well. In fact, you will notice that he looks quite scared. So I would suggest he is within one of the high-risk monitoring groups.
That
or if not, he should be.
We're self-monitoring, all of whom are healthcare professionals will now be monitored twice daily by epidemiologists and interviewed today by CDC epidemiologist.
Now this to me looks like a terrified man. You'll notice the way he stumbles over his words. Now, a Dallas County judge you would expect to be pretty well a smooth talker, but there's none of that. He looks flushed, he looks ill, and he just looks really, really scared to me. Watch the shapes he makes with his mouth.
We are, because that is an increase in workload for the CDC, DSHS, and Dallas County epidemiology team that currently has 19 epidemiologists and disease detectives on the ground. I requested additional epi team and disease detective resources at midnight last night. And they, I believe, have arrived and are meeting with Dr. Kuhar in another room.
Let me tell you what we have done, what protective measures we have taken to ensure that safety. The Dallas Fire and Rescue hazmat team has cleaned up the common areas and decontaminated any of the open areas of apartment complex in the 3700 block of Marquita. They sprayed a cleanup agent, and right now, police are standing by to make sure no one enters that apartment complex.
Well, this is the Dallas mayor. Now, you'll notice he's stumbling, he's fluffing his words as well. He is obviously under an awful lot of stress and pressure. And tell me something, if they have sprayed a decontamination agent and fixed the problem, why are the police still isolating the block? Could it be that they don't believe that the CDC recommended procedures for dealing with this in fact do not work?
Make sure that you knew instant information from us as soon as you woke up. And as you know, we're going to be staying in constant contact with you, but we're going to let CDC test this.
And now we're getting on to the most interesting part of this press release, and that is questions for the doctors.
And we'll leave you with a good doctor. Thank you.
We have time for about 2 or 3 questions for Dr. Varga.
Doctor, did this worker, is this healthcare worker someone who works specifically at Presbyterian Hospital? Did this person come into contact with Duncan on the first ER visit or when Duncan was brought ambulatory the second time? And can you talk as specifically as you can about what sort of contact this worker might have had? Was it with blood or vomit?
You will notice here there's this focus that the mainstream media has got on blood or vomit contact. As I've discussed earlier, neither of these are necessary to actually contract Ebola.
Can't speak specifically to the type of contact. This is a worker who works at Presbyterian who was involved in the care of the second visit.
The second visit?
Yes.
Was it someone who was considered a part of that high-risk pool?
No.
So this worker who has contracted Ebola wasn't even considered to be at high risk.
Was it in the lower risk pool?
Yes.
What have you changed?
Now in a moment we're actually going to hear that they're monitoring a total of 48 people, 18 of whom are considered high risk and 18 of whom are employees. Now, are we to believe that these 2 people who've had Ebola, Mr. Duncan who's died, and the latest nurse, over the sort of time period we're talking about, they have only been in contact with 48 people, including 18 in that hospital? So that's, okay, 30 people outside the hospital? I think not. I mean, I come into contact with probably a few hundred people a day. So where are the rest of these damn contacts they're supposed to have traced?
What have you done to protect other health workers who, during that second visit especially, I think there was some indication early on that there may be an Ebola case here. What have you done to make sure that other workers who were involved in kind of the same way that this worker was are safe? And if you could talk about specific measures you've taken to that point.
So all of our workers are following CDC recommended precautions.
And at this point we have to point out that that includes the worker who has just contracted Ebola.
And to be any more specific than that would be speculating. But all of our workers are following CDC prescribed precautions when they interact with the Ebola patients.
Can you say if this person was wearing protective gear?
Pardon me?
Can you say if this person was wearing protective gear when they came into contact?
They were.
with Duncan? They were wearing
They were.
protective gear?
Was this a support staff person or a medical provider?
Really in interest of the patient, or excuse me, of the healthcare workers' privacy, I won't go into further detail than we already have on that.
Going further on Manny's question on protective gear, are we gloves, mask? What other protective gear was this person wearing?
This individual was following full CDC precautions, which are barrier and droplet. So gown, glove, mask, and shield.
Okay.
So there we have it. Gown, glove, mask and shield, a fully trained medical worker, and that did not protect them. What chance do you or I have?
How disturbing it is that even after those precautions, this person is still contracting the disease.
We're very concerned.
I bet you are.
How do you assure people if somebody is, it's got to be scary for workers that have followed the CDC guidelines for them to still get infected. How are you assuring people that they can be protected?
We're still confident that the precautions that we have in place will protect our healthcare workers. We don't have a full analysis of all of the care. We're going through that right now to try to understand specific elements of who came in contact with Mr. Duncan, around what circumstances, on what day, etc. But we're confident that the precautions we have in place right now are protecting our healthcare workers.
Is this person self-quarantined over the last last week and a half or so, or have they been out and about?
The healthcare worker has been doing self-monitoring and did not work the last 2 days.
What day do you...
There you go. The healthcare worker did not work the last 2 days, so how many people has the healthcare worker seen? Have they got them traced? Are they isolated? Answer, no, don't know. It's, yeah.
Do you think this person came in contact with the fluids?
Yes, sir.
How many of the contacts from Eric Duncan have been doing self-monitoring, and do you have a number of contacts that you're tracing for this patient?
I can't give you the full details of all of the contacts. Texas Health Resources and Texas Health Presbyterian Dallas are currently tracking 18 employees.
But can you clarify?
Give us a timeline. I mean, when do you learn that this was happening, and what has happened since then until now?
I can't go into specific detail on the timeline because of the protected nature of that. I would reiterate in this particular situation, however, from the time that the self-monitoring indicated the need for contact to the time that the patient entered full isolation in the emergency department was less than 90 minutes.
Okay, so 90 minutes from the point you knew a problem existed to them being in isolation isn't so bad, but at what point did the patient become infective? Answer, we don't know.
But to
Okay,
clarify, this
we need to
person
let
was
Dr.
not
Varga-
one of the 48?
Sorry, Dr. Varga needs to
But it's
leave.
confusing because you said low risk. Low risk means one of the 48.
Yes.
This person was or was not one of the 48?
I can't speak to whether or not the patient falls into what the judge mentioned of the 48. Texas Health Resources has been monitoring 18 patients.
What day do you
Doctor,
think this person
have
got
any
infected?
sections of the hospital been quarantined or closed off because of this?
No, but to be clear, you'll recall from Mr. Duncan's care, the area that we have been using for inpatient care is I believe a 24-bed ICU that we have cordoned off and are isolating specifically to use as our isolation unit for inpatient care for Ebola patients.
And there really we have another admission. More Ebola patients are in fact expected by this hospital, and if you look at the look on his face, he has just realised that he has made a large boo-boo by saying that they're keeping 24 beds open for Ebola patients.
Mr. Varga, what's your role in this? Could you just explain?
I'm the Chief Clinical Officer for Texas Health Resources.
Is the patient being given any kind of treatment for the virus?
I can't comment on the care right now.
And that's about the end of the interview. Well, okay. So really it's a lot of don't know. I mean, they're trying to reassure people, but they're clearly scared themselves. And the judge who went into the Mr. Duncan's property, totally unprotected, is obviously the most scared of the lot. Well, I think what this shows is that the whole CDC philosophy around Ebola is just plain wrong. They don't know enough about it. Nobody knows enough about it. And who is to say that it's transmitted in the way that they think it is, and not in alternative ways as well? So there we are. I hope you found this interesting. If you want to find this full Fox News report, then that's fairly easy to do. All you have to do is type in press conference of second confirmed diagnosis case in Texas into YouTube search, and you'll find it. As I say, it's about 15 minutes long. Well, thank you very much, and if you found this helpful, please like, subscribe, and of course share it with your friends. Bye.